Health equity means to me hope, a choice, and a chance to live in access and not excess. We are all different and diverse and require different approaches to reach optimal health. And it takes time, it takes effort, it takes support, it takes community.
Health equity means everything to me. I'll give you a quick story. One time I was in between jobs. It was around 2005 to 2007. I was in between jobs. I was in school to finish up my second associate's and my bachelor's degree at the same time. I had a family of 4 children, a wife and 4 children. I actually lived around the corner from Holy Cross Hospital. Well, I took my children to Universal Circus, and my daughter ended up fracturing her arm trying to perform a stunt that she had just saw at the circus. Once again, I was in between jobs and working contract jobs and internships as I'm in DeVry to get my degrees. My daughter fractured her arm, and what did we bring her? To Holy Cross. So I didn't have insurance. Military veteran, no insurance, right? But brought her here in Holy Cross without a doubt, took care of my daughter. And it was just great to actually be a part of that. So to come back full circle, I'm back here, and that's how I'm able to give back as well.
Health equity essentially means to me providing the highest quality care that is patient and family centered, regardless of where a person lives, where they come from, their ability to pay. So this is our goal of making healthcare accessible, reachable, equitable, efficient, effective across all persons, without bias, without restriction, without barriers.
I think health inequities is like people need to know that we are here to service anybody who comes to our hospital for whatever their healthcare needs are, regardless of anything, whether it's monetary, spiritual. We meet all of their needs. We see the patient in a holistic way. So that we can attempt to meet every single one of their needs, or at least get them attention to somewhere who they can help them with.
Health equity is more than a movement, it's a lifestyle, because it's about changing your approach to everything that you do, because people are different, the world is different, and we all come with our own set of complexities and different ways that we do and operate. But bringing equity is meeting somebody where they are and not seeing them as a whole, but seeing them as an individual. And I think that is so important. And if we walk through our daily lives understanding that everybody at every stage is going through something different. So when I approach you, I'm approaching you as an open slate. And I want to give you as a friend, as an educator, as a caregiver, what you need in that moment.
I encourage you to continue to look at yourselves and identify just ways to get more involved, to encourage and help to influence mirroring the population that we serve, which is another great way of promoting diversity and health equity. I encourage you all to raise your voices and get involved at a much larger level, at the state level, at the federal level, to actually influence policy that actually is going to help to change the health equity equation.
To be engaged in supporting health equity I think is very simple. You look at the community in which you serve, or the community in which you're a part of and affiliated with. Once you understand the dynamics of the community and social economical issues that are plaguing certain communities, you can give back to them.
I think we can achieve healthcare in our equities in our communities by going out to the community, such as offering the vaccinations out at the clinics and us going to the community instead of the community coming to us. We can provide translators and interpreters that are able to get that education message across so that they understand that we're here to help them, not be scared of the vaccinations. That is going to be really what's going to be our saving grace to be able to help us move to that next level.
What I do with me and my team outside of my work here, I go and I clean up various neighborhoods throughout the city of Chicago. That's in a lot of impoverished communities in the city. We pick up trash and cut grass for the elderly as well. I do that. I don't ask for a dime doing it. I do it because it's from here, and that's how you can give back. Do simple things like that, because if the outside looks good, hopefully some of the inside will start to reflect the outside.
But by showing up every single day and doing the work that you all do, you're already halfway there. So just continue to be yourselves and make a difference.
What somebody can do to start being engaged in health equity is to be human, is to be real and open and share knowledge, because people perish because of lack of knowledge. And I believe as we teach one, we reach one, and we expose people to worlds that they never thought were available to them. And being a person that's willing to give of yourself is a way that equity can begin, because it's listening, having a heart, and having a conversation to get to know somebody beyond surface level. And so I invite you to just be human and treat people like you'd want to be treated.
But one of the things I can honestly tell you is Sinai Chicago is in it for this. This is most definitely deeply rooted in our mission. This is very much a part of what we are and what we do. And just your commitment to Sinai Chicago alone demonstrates that you're in this to make this a better situation for everyone.